Nomafrench Mbombo, born and bred in the Eastern Cape, a township called Entails near East London. I see myself as a human rights activist, a mother of two girls, so that's who I am. I'm one of those people who have done it all. I've been a public servant working in departments of health in the Eastern Cape, also for the local government in Department of the Health. I've worked in the KZN. I've done a lot of consultation on health matters in the Africa, in the United Nations. And then when I came to the Western Cape, I was an academic, also teaching in health. So health has always been a part of me. Now, what made me now to be a politician? I thought probably if I could lead and be part of the people who make decisions, not only about teaching or research. So I'm here to be a servant. Growing up in a township, it has always been common that you either want to be a teacher or to be a nurse. So that you can make a difference what is surrounding you in terms of the ill health, in terms of the social ills as well. So for me it was about, I knew that I wanted to go into health because I wanted to help a lot of people who were sick. The overall aim of the Department of Health is to render health services. For me it's about creating a healthy population than focusing too much on the disease because at the end you might end up having a lot of diseases where you might not be able to treat. So it's important, starting with a self-help, where people should take ownership of their health by physical activities, taking healthy food and so forth. But what is important is about understanding that health is a universal recipient, receives all other social ills. So whether you end up being poor, you have to end up in health. Whether you are rich, you'll end up being health. So for us in the Western Cape, we service about 6.7 million of the people, from the unborn to the oldest person, including the deceased. Fortunately, we've got an opportunity where we could be able to build more health infrastructure. Part of it is about having these infrastructures where it creates a healing environment. So 1.2 billion has been invested in the infrastructure. Secondly, patient dignity is about patients need to be treated as indicated with dignity. We have to professionalize the health services. We have to take care, the staff comes first so that they can make the patients to come first. So caring for the carers is essential because we don't have money to appoint more people, but at least we must show that we care. And then lastly is about how to make it a point. We use innovative interventions, especially to reduce the waiting time. So it's some of those things that you want to focus on, but at the end, it's about the whole issue of the prevention and the promotion in terms of the fighting disease. It's about where you reduce the burden of illness for the people so that we can have a healthy population that can contribute to the economy. Keeping girls in school longer is one of those, because we do know that with the education and when especially a girl child completes matric, that person has got a chance of being able to own her decisions, especially in the matters related, for example, with the safe sex and so forth and so forth. So education is very important. And also lastly, it's about where you take ownership of your own health in terms of knowing your health status. Health status, not only about the HIV testing, it's about going there for the screening, for the mental health. So one of the things that impact the young people is about the depression, anxiety and so forth. And also to be able to say no when it comes to being influenced, peer pressure, substance abuse and alcohol.